Good evening, everyone, and welcome to the RPS Southside Regional Community Conversation. This is the first of a series of conversations for students and families to learn more about our reopening plans this fall. Now, we are excited to announce that we will have weekly sessions solely for our school and central office staff coming up in the coming next month. But right now, we really wanted to focus on hearing from our families and our students as we hear about some important reopening updates. I'm Shonda Harris. I have the privilege of serving as the division's Chief Engagement Officer, and I am joined today by Superintendent Jason Camrus, our student moderator, Israel Torres Castillanos, RPS Hub Coordinator for our Southside, Chastity Rodriguez. Also, we have doctors from the Children's Hospital of Richmond, Dr. Jose Munoz and Dr. Belen Papa, as well as school board representatives. We have Ms. Nicole Jones, Ms. Dawn Page, Mr. Jonathan Young, and I hope I didn't miss any school board members. Please let me know if I did, Matthew. I only see some faces, but we're so excited for everyone to be here with us today. Now, our goals of the conversation are really to provide families with updates, and you'll hear from Superintendent Camrus, but we also want to hear from our healthcare professionals, and we're going to have a Q&A with them on some of the questions we've been hearing for our families to get a healthcare professional's take on them. And then at the end, we'll make sure we leave it open to answer your questions for as much time as we can. Now, without further ado, I would like to introduce you to Israel Torres Castillanos. He is a senior at Huguenot High School, and I'll let him share a little bit more about himself. Israel?
Yes, so hello everyone. Thank you, Dr. Harris. My name is Israel Torres Castillanos, as all of you just heard. Well, I am excited to be part of this very important discussion. As we prepare to reopen our schools, it is very important to discuss the process. It is also very important to remind everyone that this is something that does not only involve the school board. This is something that also involves students as well as parents. I want to thank everyone who is listening for joining the meeting this evening. We have members of the community who have joined by phone, by computer, and who are even in person at a watch location. Thank you for taking the time to be here. We want to share with you how you'll be able to participate in tonight's discussion because it is very important that we hear from you. Now I will turn it over to the RPS Hub Coordinator for the Southside, Chastity Rodriguez, to review how those listening and watching can ask questions.
Good evening, everybody. Thank you, Israel and Dr. Harris. Welcome to everyone viewing. Before we dive in tonight, I want to review just some protocols and norms for our discussion today. We are using a webinar format. And so as attendees, you all have the ability to send a chat to ask a question. And please use the raise hand feature that you'll be able to locate on the toolbar of your Zoom to let us know that you would like to speak, and we'll be more than happy to unmute you and let you ask your question. If you are in person, please share your question to the site host, and they will enter into the Zoom chat for you. Now, without further ado, I am going to hand it over to our very wonderful Superintendent, Jason Camrus, to go over some reopening updates.
Thank you so much, Chastity, and thank you, Dr. Harris and the entire engagement team. Thank you to Board Member Page, Board Member Young, Board Member Jones for joining us this evening. And thank you to Israel, who is such an incredible example of the wonderful students that we have in RPS. I've had the pleasure of getting to know Israel through my advisory cabinet, and he always has incredibly thoughtful and insightful things to share, which really do help shape my thinking and the thinking of the leadership team. So thank you to you, Israel, for being here this evening. It makes it especially special. So thank you. I am extremely excited to be talking and planning and thinking about next year. This has obviously been a very difficult year on so many different levels. But with the sun shining and the air getting a little bit warmer, and with the vaccine broadly available, I hope folks are beginning to see and feel some light at the end of the tunnel. And I know I'm excited to open up in person. We're going to reopen with Love 2.0, as Dr. Harris says. And I just can't wait to give all those high fives and hugs and be near our students again. So with that, I want to lay out first just 3 high-level principles that are going to guide us as we reopen. So first and foremost, as we reopen with Love 2.0, we want to make sure that we extend the same grace and love and flexibility that we extended each other last year. We know it's going to be a big change coming back to school, and we know everybody is going to be working with the best of intentions to make this as wonderful an experience for our students as possible. But it's going to be an adjustment for some kids. Think about first graders who were virtual for kindergarten, perhaps didn't participate in a preschool program. They'll be coming to school in person for the first time as first graders. So it's going to be quite an adjustment for everybody, not just our kids, but the adults as well. And so extending grace to each other is going to be essential. Second, and one of the key aspects of tonight is our primary priority is to ensure that we protect the health and safety of our students, our staff, our families. I'm proud that we've done a wonderful job of doing that this year, made some hard decisions, but I do think we were able to ensure that everyone was safe. And that is something that we are, of course, very committed to next year. So we're doing all kinds of things that I think folks will be really excited about to see when they come back. In-room HEPA filtration units in every classroom, every common area. We've been upgrading our bathrooms. They'll have touchless paper towel dispensers and soap dispensers, all kinds of other upgrades in the bathrooms as well. Hand sanitizer stations in every bathroom and in common areas, and so much more. So that is going to be critical, but it's not just everyone's physical health that we want to support, also their mental health, and that goes for students and for staff as well. And so we're making huge investments in those kinds of supports as well, with partner organizations and more staff in our schools. And then our third key principle guiding us is to communicate, 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 which is what tonight is all about. We know coming back, folks are going to have a lot of questions, and there are going to be a lot of details and a lot of things to absorb. And so we're excited to kick off that conversation tonight with our Southside families and students. And then, as you hopefully have seen in RPS Direct, we have lots more of these conversations scheduled, and we'll have lots of other avenues to share information. My RPS Direct, our community liaison, family liaisons out in the community, talking directly with families, sharing written information. We have our family support line, so much more coming over the next couple of months. I want to thank Dr. Harris and her entire team for the wonderful work that they are doing on that front. All right, so let me get to the perhaps most important decision that families will need to make as they prepare for next year. And that is which of the 2 pathways they are going to select for their students. So the first pathway is 5 days a week of in-person instruction. 5 days a week, in-person instruction, just like any other school year. It'll be a little bit different because everyone will be wearing masks and we'll have all the other mitigation procedures in place, but we are strongly encouraging everybody to come back in person if their health will allow it. So again, 5 days a week in-person instruction, that is the default option. You don't need to do anything to choose that option. That is what you will be signed up for. If that is what you would like to do, you don't need to do anything. If you would like your students to remain virtual, and we understand there are some particular health reasons for some families why that might be the case, then you do need to let us know. And on our website, which I'll be sharing the link tonight in my RPS Direct, there is a form in English and in Spanish where you will formally sign up to have your students participate in our virtual experience next year. I do want to say just a couple words about the virtual experience. From preschool to 5th grade, we're going to be running our own virtual academy here in RPS, staffed by RPS teachers. And so your student will be with students from all around the division. For 6th through 12th grade, we're going to be using the Virginia Department of Education's online program, which is called Virtual Virginia. So they won't have RPS teachers, but they will have Virginia licensed teachers. So don't worry about that. But again, we strongly encourage as many families as possible to come back in person. To do that, you don't need to do anything. That's what you're automatically enrolled for. It's only if you want to take the virtual path that you will need to fill out that form. And you have until June 1st to make that decision. June 1st to let us know if you'd like to come back virtually or not. With that, I'm going to pause. I see that we have been joined by board member Dr. Shonda Harris Mohammed. Welcome, Dr. Harris Mohammed. And I just want to say, before I turn it over back to Israel, how grateful we are to our teachers and our support staff and all of you, our families and students, for the incredible work you've done this year, literally reinventing the school system at the drop of a hat, and done so beautifully. You truly have shown what it means to teach and lead and serve with love. And I am just so excited to see what we can do now that we've learned all this incredible knowledge about technology and how to increase our skills and reach more students when we come back next year. With that, thank you so much, and I'll throw it over to Israel.
Thank you very much, Superintendent. I have one question for you regarding health and safety in the school. So my question would be, and I'm pretty sure a lot of students and parents have the same question, is how are we going to be able to maintain the schools clean and safe for every student? Because as you may know, well, RPS is a big place, and there's a lot of students in every school. So the halls can get pretty crowded sometimes. So what is the approach we are going to take for that to limit the amount of contact?
Yes, each school will have a school safety plan to help limit the amount of contact. Right now, the guidance is 3 feet of separation, though that might change before the fall. As we have shared in our reopening plan with the school board, we're going to do everything we can to maintain that 3 feet of separation. We understand there are going to be times when that might not be possible, perhaps during passing and whatnot, but that's why we're also going to have masks for everybody at all times, except when you're eating. It's why we're going to have those filtration units everywhere, why we'll have all the hand sanitizer and whatnot. With all those mitigation strategies, and I think the physicians tonight can share more about this, and with widely available vaccination. And by the way, down to 16 years old. So any high school students who are watching, if you're 16, 17, 18, go get the vaccine. You can do that now. There's a chance that the vaccine may be available to younger children before school starts. So I strongly encourage folks to take advantage of that if that becomes available. The risk with all of those mitigation strategies of transmission is very, very low. We've seen that from data over this past year. And so I will be sending my 2 boys back in person full-time next year. And that's how much I believe in all of the work that we are doing to make it safe.
Thank you very much, Superintendent. I know that myself and so many people have questions about health and safety as we prepare to return to the school buildings and how things will work. A lot of us also have questions about the vaccine, especially now that vaccines are available for students 16 years and older. Today, we have invited doctors from the Children's Hospital of Richmond here to answer some of the health questions that we've been thinking about. Dr. Belen Papa is a resident physician at Children's Hospital of Richmond at VCU and mom of a new baby. She plans to be a general pediatrician upon completion of her medical training in July. She is fluent in Spanish. Dr. Jose Munoz specializes in hospital medicine and infectious diseases at Children's Hospitals of Richmond at VCU. He has a particular interest in quality improvement and is fluent in Spanish as well. Thank you so much for being here.
And thank you for inviting us.
Yeah, we're very excited to be here. And I'd also like to echo a big thank you that was said earlier to all the teachers and all the members of the school board who have worked so hard in this process. I'm a daughter of a teacher, not in the state of Virginia, in the state of Maryland, but I know how hard you've all worked this year.
Israel, I think you have some questions for the doctors now.
Okay, so yeah, thank you for that. Chastity and I would like to ask you a couple of questions. My first question for you this evening is, more leaders are encouraging schools to open and for students to return to in-person learning. Can you share what has changed in the last year that makes it safer for students to learn in person?
Yeah. I think the biggest change, Israel, has been that we now have a better understanding of how we transmit this disease. And then we also have the huge advantage that we now have a vaccine to combat this illness. So things like knowing how to take care of ourselves against this condition, making sure we keep a safe distance and protect each other by wearing masks and washing our hands routinely are all things that we knew from before, but we've really enforced in the past year, and we've seen the impact of doing that and how it's helped prevent the spread of the disease. And then I think the biggest thing that has changed in the past year has been the availability of the vaccine. And like was mentioned earlier, up to 16 and older.
I would agree completely with what Belen said. I think that has changed. And the vaccine, the other thing that the vaccine makes a difference is that, I strongly encourage, the parents, the grandparents, anybody who lives in the house to also be vaccinated. One of the concerns we had at the beginning of the pandemic is that, let's say, young people get infected. In general, it's not as severe as older people, but then there was a concern, could they bring it home to the parents, especially if they're grandparents living at home? And I think if we ensure that everybody 16 and over is vaccinated, I think school teachers and school personnel should be vaccinated, and family members are vaccinated. That totally changes the risk equation.
Thank you very much for that. So another question is that all students will be required to wear masks when we return to school in person. Could you talk about the importance of wearing masks and how it helps stop the spread of COVID?
The masks stop this, by the way, Belen and I, I worked with Belen actually, several times throughout the pandemic. So we continue to work in the hospital, from the beginning of the pandemic, and we wore a mask every day. It's interesting, at the beginning, I used to complain more about it. I think we've gotten used to wearing the masks, and it's not, it's now I do it and I don't even think about it. But the mask prevents in two ways. It prevents virus that may be in the air from coming into your nose and your mouth. And if for some reason there's an individual that has virus inside of them, it also keeps the virus from coming out into the air. So it protects both ways. And again, at the hospital, we do all our work with the mask on. We've been doing that since March of last year, when the pandemic started, and we have been able to maintain a safe environment in the hospital setting.
Yeah, and just to add on to that, it's not just against COVID. The mask wearing is also protecting us from spreading other illnesses that we can pass with talking or breathing in and out. So what we've seen also in the hospital is that we've had very little upper respiratory infections this past year and this past winter season, very little flu as well. And that's going to be important too, because as we'll probably touch on later, we, as kids return to school, we're going to be monitoring for symptoms. And sometimes a kid that has a fever in the beginning, because they have the flu, may not look any different from a kid who has a fever because they have COVID. So I think protecting ourselves from not just COVID, but a lot of viruses that are spread through our saliva and our respirations can be helpful to sort of prevent unnecessary absences from school too, because of symptoms that may not even be COVID.
Thank you very much for sharing that information. I think it's very important that everybody knows why we wear masks and that it's not just a piece of cloth on our faces.
Israel, does our answer help you? Especially when you talk to people, the fact that it protects you on the way in and it protects the air on the way out. So it's a two-way. And
right.
The other thing, and when we're talking about masks, remember that it's important that people wear their masks properly. That the mask should be covering the nose and the mouth. And that's all I wanted to add. Sorry to interrupt.
Yeah, I agree. I brought one to share, Dr. Munoz. It does have to cover the whole nose and up until the chin down here. Otherwise, it doesn't work.
Oh, that was great, Elaine. Thank you.
Yes, thank you for sharing that information. That was actually my next question. So I believe Chastity now has some questions for you as well.
Absolutely, thank you. And thank you both, Dr. Munoz and to Dr. Papa, for the information that you shared thus far. Dr. Papa, you mentioned this, and so I wanted to kind of go back and touch on it because I'm pretty sure teachers and probably families alike are curious just about when it comes to symptoms. What are some of the symptoms that parents should check for each day prior to sending their children out to school?
Yes, I think this is a very important thing to kind of keep on the radar. Fever, obviously, is something to be on the lookout for. Respiratory symptoms, so nasal congestion, cough, shortness of breath, all those things could be signs of COVID. A lot of people report that they lose their sense of smell or taste as part of the symptoms that are associated with COVID. And in kids, we actually have seen some kids present with diarrhea. So GI symptoms rather than a lot of respiratory symptoms. So that's those are kind of things to be on the lookout for. And again, like I said before, these symptoms can also be present with other conditions that are not COVID. So sort of keeping an eye on these symptoms and just making sure that we're avoiding contact with other students if we're feeling any of these things, or if anyone in the household is also experiencing any of these symptoms.
Dr. Munoz, would you like to add anything?
No, I agree. The only thing that can be a little bit tricky sometimes to sort out, especially like for example, like right now, we're going through a little bit of an allergy season in Richmond. I was just watching the news a little bit earlier before coming on the Zoom, and they were talking about all the mold and pollen and that's in the air. So if you know that you have seasonal allergies and you have a little bit of that sort of nasal congestion, that's probably okay. If there's any question, you can always call the doctor, have somebody check something. Usually with COVID, you wouldn't just get that little thing. You would also get, like Belen said, you might get a little bit of fever. You might get body aches, like you don't feel well. So I would say to look at that. But if there's any question, stay at home, call the doctor, and just go over it. But people usually know that they get seasonal allergies, and I get them. Like right now, I'm taking my little nasal spray in the morning.
I completely understand that. I was actually, my mom had been going through that recently, like all the sniffling. And I'm like, Mom, you good? She's like, yeah, not COVID, just allergies. So I completely understand what you mean there. But just as a follow up, sorry?
I said people usually know. Yeah.
Yeah. Just as a follow up, though, I did want to ask if both yourself and Dr. Papa could expand on just why is symptom checking going to be important for families to keep an eye on and for them to do regularly?
Absolutely. Can you repeat that again? What kind of?
Yeah, so I just wanted to know if either yourself or Dr. Papa could expand on like why for parents is symptom checking going to be important for them to do on a regular basis?
Yeah, it's important because again, it's you don't want to be in school when you have the infection and put others at risk. Even though with a mask that would provide some protection, but still you don't want to be in school. But so I think it's just common sense. I mean, frankly, I think that's a guidance that we should follow even before COVID, let's say during flu season, during other virus seasons that are going around. I think if you feel like you're coming down with something and you have like any kind of respiratory illness, you should not be in the school setting until you've been cleared.
Yeah, and I think the bottom line to that is to sort of explain it a little bit more in detail is that when you have the symptoms, when you're feeling ill, you're then capable of passing it on to others. You have enough virus in your body that you can pass it on to others. So if you've gotten to that point, then you're risking passing it on to your friends at school or other family members.
Dr. Papa, thank you. I think that's an amazing point. Just because I'm sure there are probably a lot of families thinking and wondering. So I will go ahead and ask, what is it that you recommend, or what is it that families should do if their children do present symptoms of COVID-19?
Yeah, so I think like we were just saying, staying home if you are having symptoms. And now the recommendation is actually getting tested. And there are several places where you can get tested without sort of as a drive-through, without really going into a hospital or a doctor's office where you may come in contact with other kids and pass along the infection to others. So the best approach is to usually call your pediatrician. I know at VCU, when we receive calls, we're able to put in orders and have patients come in through our drive-through and get tested. And I believe other pediatricians have the same capabilities. I believe Dr. Munoz, correct me if I'm wrong, I think there's some urgent cares also that provide some drive-through testing.
There are.
So,
and I don't know, maybe from the school staff, do you have like a list of places where students can be tested, or anything through the health department or through the school system that can facilitate that? Because testing doesn't really need like a whole, if somebody is not very ill or anything, and it's just a question of you have some new symptoms and you want to make sure that you're not infected, the best thing is to arrange for a quick test, that can be done. And again, always err on the side of caution and stay home till it's all been clear.
Yeah, we have a great partnership with the Richmond Health Department, so we definitely can make sure like our website is updated with all the different places you can be tested and share that with the community. I want to ask the doctors, can you just shed a little light on, the reality is families are worried, like, is it safe to come back in person, right? Like, that's the bottom line. Like, can you say a little bit more about kind of, families who are just wondering about, is it safe for students to return to school?
The answer is yes. I believe if you follow the guidelines from the health department, if they're saying 3 feet separation, that should be the guideline. If you're wearing mask, you wear the mask. the staff and as many people that anybody who's eligible for vaccine should be vaccinated. But at the same time, let me just say that I completely understand that sentiment. You know, I am a little bit older. You can probably tell on the Zoom that I'm a little older than Belen. so you know, when older folks are a little bit more risk of more serious COVID. So when I first went back to work in the hospital, I had some of that apprehension myself. And again, the way I dealt with the apprehension was being very compulsive about my hand washing, by always wearing my mask, keeping separate, keeping distance, not being in a room, without my mask on, had to change my eating habits and all. But that was at the beginning of the pandemic. I think as we learn more, we realize that following these instructions really makes it quite safe. I have a niece who lives in Asheville, North Carolina, and she's a second grade teacher. Oh my God, I was talking to her like 5 times a week at the beginning of the pandemic when they were reopening her school system, and she has 2 daughters. So those would be my grandnieces, and they were very nervous about it and so on. You know what? They've been going to school now for like 6 months, doing very well. The girls wear their masks. When they go to school, the thing that I always remember the most, that struck me the most, is that after several months of not being in school, when she called me that evening just to tell me how things were going, she said that her daughters were literally almost like crying with happiness to be back in school. They just missed the whole interaction with their friends, with their teachers, the whole learning environment. I think it had such a positive effect. And so once they got used to the new routines that they were following, they were like, again, like I said, they've been going to school on a regular basis. And I think Asheville is not that different from Richmond in terms of how much COVID they have had. I think the positivity rate and the number of cases is similar. And everybody just got used to the new normal, but being back in school. I don't know if that helps you. If you want to add something, then.
Yeah, no, I agree completely. I think a normal degree of being nervous is completely normal. It's understandable. This was something that hit the whole world, and took us a little by surprise. So it's normal to be scared and to be nervous about it. And like Dr. Munoz was saying, getting adapted to a new normal. I similar to what he said, he was nervous coming back to work when we were seeing patients with COVID in the hospital. I myself also was pregnant throughout the whole pandemic, and I was very nervous too, to be working directly with patients that had COVID, examining them without really knowing what impact that would have for me. And I think the bottom line was that I just kept a very good control over the things that I could control. So I could control the way that I washed my hands and the frequency in which I washed my hands. I could control when and how I wore my mask, which was always and appropriately. I kept a close check on how I felt. And if I ever didn't feel right, I stayed home from work. But I can say this was all before getting vaccinated. And I took care of many patients with COVID, and I never contracted the disease myself. And I attribute that to the fact that all these measures that we take, if we do them properly, they work. And so I think it's going to take a lot of work from everybody, and being conscious about how we take care of ourselves and each other. But it's definitely, like Dr. Munoz was alluding to, I think a movement in the right direction, because being out of school has played a huge impact in the mental health of the children in our community too, and they need to go back in a safe way.
Thank you so much for sharing that, both Dr. Papa and Dr. Munoz. And I am going to hand it back over to Israel in case he has any last questions that he'd like to ask.
Thank you very much, Chastity. So I have one last question, and that is, what are some other tips that are important for us to know in order to help fight the spread of COVID-19 and keep our students safe?
think I would say get vaccinated if you can. Is that what you were going to say, Dr. Munoz?
Yep, get vaccine.
Steal your line.
Vaccine is number one.
Yeah. Yeah. And I know some people are apprehensive about that too. Because I've heard from a lot of people say that this was a vaccine that got developed so quickly, and the technology behind the vaccine has been around for a while and has been investigated for a while, so it's not as new as we perceive it to be. So I think that's important to remember. And I've been vaccinated myself. Everyone in my family has been vaccinated. I think that's very important too. It's not just the children 16 and older that are in school age that should be getting vaccinated, but also the families at home, because we can all protect each other in that way. And to those who are concerned about sort of the symptoms around getting the vaccine, I can speak for myself and a lot of my family members. For the 2-shot vaccine, either Moderna or Pfizer, a little bit of a sore arm for the first shot, and a little bit of body aches, sometimes a little bit of fever for the second shot a month later. But otherwise, it's something that it doesn't really affect your daily life that much.
I agree completely with Belen. And the other thing, I think it's important, not to exaggerate the danger, or not to be overly concerned. And at the same time, it's important not to ignore it, to ignore it. Sometimes people it's easy to get into like a denial thing, that just saying, I don't believe in this or whatever. That it's going to get you in trouble. If you let it consume every single thought of your day, that's going to be, the way I think about it, even before the vaccine, at the beginning, sure, we were all a little bit nervous, but I never stopped going to the supermarket, to get when I need to get things. My wife and I would go to Costco, we need to get, we wore our mask, they had the little dots, to stand a certain distance from somewhere else. I think it really helps you both to stay safe from the virus standpoint, but also just mentally to just follow certain procedures the way they're recommended. I think if you do that, I think it can work extremely well. And like I said before, I think the benefit of being in school and being able to have the social interaction plus the educational experience that you can have in person, I think that is a tremendous thing.
Absolutely, I completely agree with everything you just said. Thank you very much for sharing that information. At this time, we are going to open it up for questions and for the questions and answers part of the program. We will take questions for Superintendent cameras, and if you have any questions, please feel free to send the chat. We ask that you use the raise hand feature in Zoom to let us know that you would like to speak, and we will unmute you. If you're in person, please share your questions to the site host, and they will enter into the Zoom chat. So I am going to check the chat, and it looks like we have a lot of questions. So I am going to be asking some of these questions randomly. So let's see. Okay, so this one is from Patricia McGowan. She says, as a retired educator, I am concerned about sufficient personnel to supervise student behavior. Will all teachers and school personnel be vaccinated prior to reopening? Please do not make light of others' concern.
Thank you, Israel, and thank you, Ms. McGowan. At this point, we are not able to require the vaccine, given that the CDC has only approved it for emergency use. And so we are not stipulating that every staff member must get vaccinated. That said, we are strongly encouraging it. We understand that there might be some unique medical circumstances where there might be a concern, but barring that, we are strongly encouraging everybody to get vaccinated, and not just our staff, but family members as well. And again, students down to 16 years old, please go ahead and get vaccinated. As Dr. Munoz and Dr. Papa said, That's probably the number one thing we can do right now to stop COVID in its tracks. If we can get to 70% vaccinated or thereabouts and achieve herd immunity, it fundamentally changes everything for us, not just here in Richmond, but all across the country. So again, not a requirement, but we are strongly, strongly encouraging everybody to get their vaccine.
Thank you, Superintendent. This next question is from Catherine Shearer. She asks, how was the June 1 deadline chosen? As we know, COVID is constantly changing, and families may change their minds about in-person if new information is available in a few weeks.
Yes, excellent question. Thank you so much for sharing that. This is one of those tricky things where we want to make sure we give families enough time to consider this decision, but also make sure we have enough time to plan accordingly. So June 1 was our best effort at that. We understand that things might change. And of course, if there are dramatic changes, we will respond in kind. But we do need to know how many students and which grades will be virtual so that we can hire the appropriate personnel and get ready so that we can provide an outstanding educational experience for our children. So we're going to try to do everything we can to get you all the information that you need over the next month or so that by June you're able to make that decision. I do want to note families are going to be able to move from virtual back to in-person. Basically, preschoolers all the way up to 8th grade will be allowed to do so at the quarter mark. So after the first quarter or second quarter, third quarter. High schoolers will be able to do that at the end of the semester mark. That's because our classes are semester-long classes. And if they change in the middle of a course from virtual Virginia into RPS, their credits may not exactly work out. So there is that option. So families who do choose virtual will still be able to come back in person as well.
Thank you very much, Superintendent. Next question is from Cami Smith. The question is, what is the procedure or protocol for a positive student or teacher? Will schools have to close for days at a time?
Thank you, Israel. So the CDC guidance and the Virginia Department of Health guidance on this has evolved quite a bit from the early days of COVID, where first we just shut down completely, and then for schools that did open back up, when there was a positive, the whole school shut down. The guidance now is much more tailored to the circumstance. So if there's one student in a class, there might be a quarantine of the class, but there's no need to shut down the entire school. And so we are going to follow the guidance that the CDC provides on this. It continues to evolve, but really the guidance boils down to trying to contain a closure to the smallest reasonable unit. So in many cases in schools, that would be a class, not an entire school. Of course, we'll continue to monitor the guidance, but that is likely what would occur in this case next year, assuming there was a positive. And again, the more people who get vaccinated, the less likelihood of a positive in the first place.
Thank you, Superintendent. Next question is from Jonathan McDermott. The question is, for students that have asthma or other health issue, will there be a break from wearing a mask?
Great question. We don't have a protocol for that now, but we'll add that to the list to figure out a way to give such students an opportunity to take their masks off. I would ask Dr. Munoz and Dr. Papa, do you have any experience with students who have asthma and mask wearing, and have there been any mitigations that physicians have recommended, or any insight you can provide would be wonderful.
The main comment I would make would be, I haven't had contact with students who have asthma, but I have had contact with healthcare workers who have asthma. And I would say the most important thing is to make sure that with their physician, that their asthma is as well controlled as it can be. You know, we use it with what are called controller medications. So sometimes people only take like the inhaler when they're having an asthma attack, but there are medications that you can use to really keep your asthma under control. So I would just make sure that any child with asthma, before going back to school, and actually at any time, consult with their doctor just to make sure that they are given the degree and the severity of their asthma, that they can be on good control of medication. The other thing is just to make sure to be flexible, and if somebody feels like they need a little break from the mask or something, just ask for permission and go outside, take a deep breath, and come back in. You might need a drink of water or whatever. But I think controlling the asthma would be the most important thing. Anything you would add, Belen?
No, I absolutely agree. And speaking as someone who has pretty severe asthma myself, the mask wearing has actually helped quite a bit with asthma exacerbations in this season. I've seen it with myself, and I've seen it in the hospital too. We basically block not only viruses, but also things like pollen and other irritants that can trigger asthma attacks, and viruses themselves can trigger asthma attacks too. So yes, like Dr. Munoz was saying, if the child feels like they need a little bit of a break, and this really goes for really anyone, they should have something in place for them to remove the mask and take a break in a safe way, in a safe distance from other students. But the asthma itself shouldn't really, wearing the mask with asthma shouldn't really be an issue.
Thank you so much, Dr. Papa and Dr. Munoz. My takeaways are, one, asthma itself shouldn't be an issue with masks, as you just literally said. Two, the mask may actually help, and I think you would agree that having an in-room HEPA filtration unit in every classroom will probably help with the asthma as well, particularly in some of our older buildings that don't have the same kind of modern airflow. And then three, proactively, families can take steps to keep asthma in check as much as possible with the appropriate medication. So it might make sense if you guys would advise it for families to set up appointments with primary care physicians if your child has asthma, and just make sure you have all the right medication to keep things in check as you plan for the upcoming school year.
Yeah, absolutely.
Thank you very much. There is something that I believe a Hispanic parent said, because it's in Spanish, and the translation is, I think that the vaccine should be a requirement for families to send our children to school, because most Hispanics don't want to get the vaccine, but they do parties with many people. And that scares me to send my children to school with so many people who do not want to be vaccinated.
I certainly understand the concern. Unfortunately, again, given that the vaccine is under emergency certification from the CDC, we're not allowed to require it at this time. Now, that might change over the next several months prior to the start of the school year. So one of the things that everybody on this call can do is continue to spread the word about the vaccine, continue to spread the facts, which are that it is safe, and continue to highlight family members, community leaders who have taken the vaccine. If there are any watching now, to talk with your communities about its safety. I myself have gotten both of my shots, and yes, there were some mild side effects, but they were mild, definitely mild compared to getting COVID-19. And so again, I strongly encourage everybody to get the vaccine, not just for yourself, but for your family and for your community. The more of us, again, that get the vaccine, the better off we are all going to be.
I second what you said. I think it's very important for any child or 16 and over to get the vaccine, for the staff to get the vaccine, and for the families to get the vaccine. Por lo que están escuchando en español, lo más importante es la vacuna. La vacuna, la familia debe estar vacunada. Si el muchacho tiene 16 años o más, debe tener la vacuna. La vacuna es, los peligros son mínimos, un poco de incomodidad, un poco de dolor de brazo, a veces uno se siente un poquito mal al día siguiente, y después pasó, el superintendente recibió su vacuna en Belén, la doctora Papa recibió su vacuna, yo recibí mi vacuna en diciembre, y en enero las 2 dosis de la vacuna, y de cierta forma uno se siente como con un poco de libertad, que se siente un poquito más, no que uno va a seguir las reglas como quiera, pero le da esa sensación que tú sabes que tú tienes ya un poco de protección interna por la vacuna. Belén, ¿algo que tú quieres añadir?
No, solamente recordarles a todos que así todo después de la vacuna, no hay que bajar la guardia tampoco. Por lo mismo que ese padre ahí estaba comentando que le da miedo que otras personas, que el vecino quizás de al lado no tenga la vacuna dada. Por eso es importante que aunque nosotros nos damos la vacuna, igualmente seguir usando la máscara, seguir manteniendo distancia, seguir chequeando síntomas y protegiéndonos con no solo la vacuna, sino con todas las medidas de precaución que hemos aprendido en todo este año, porque todas en conjunto nos van a dar la mayor protección, y no bajar la guardia, así todo cuando nos hemos dado la vacuna, que eso es muy importante.
The short version of that is not only is it important to get the vaccine, but to maintain all of the other mitigation strategies, wear your mask, wash your hands, do all the things that we know are simple to do, and they keep us all safe. So get the vaccine and keep your mask going, and all the other important measures.
En español, mi madre siempre le gustaba decir una frase que decía, a Dios rezando y con el mazo dando. Which was to God praying, but with a hammer hammering. And I think I think in some way that phrase is somewhat related to what you say. Get the vaccine, but follow the guidelines.
Absolutely. We definitely agree with that. And thank you for everybody that has asked questions in the chat thus far. We do have a couple of people that are in queue that have raised their questions, raise their hands, for questions via Zoom. So we're going to go ahead and Letitia Irby, thank you for having your hand raised and free to ask your.
Hello.
Hello.
Hi, Mr. Jason.
Hi, Ms. Irby. How are you?
I'm good. Sorry about my background.
No worries.
I was wondering, I heard that you said about the middle schoolers, if they pick in person or virtual. My question is, if I choose virtual for my middle schoolers, will they still be a part of the regular RPS school, or like events, PTAs, anything that's dealing with the school, if they're doing Virginia virtual?
Yes. Thank you so much for raising that. And that's true for, for all students, but particularly middle school and high school. If you go virtual, which means you'll be part of Virtual Virginia, you can still play on your home school's sports team. You can still participate in activities and extracurriculars and things of that nature. So thank you for raising that. Yes, that's very important.
Okay, thank you.
You're welcome.
Yes, thank you so much, Ms. Irby, for that question. I think we all know that the socialization piece is probably one of the biggest things that many of us miss as a result of this pandemic. So thank you so much for raising that question, Ms. Irby. We're now going to go ahead and move on to Ms. Lakeisha Williams. I'm going to go ahead.
Good afternoon, everyone.
Good afternoon, Ms. Williams.
Hold on, Ms. Williams, I think you may have accidentally gone back on.
Yeah, I muted myself again. I don't know what happened. But I may have a few questions, but they may be able to be answered all in one. So as I expressed, Mr. Jason, no, I have a child and also myself that has health conditions that right now the doctor is recommending that we not get the vaccine. So due to the future of possibly making it mandated, what is the vision or exceptions for students and staff who can't if a mandate was to become in place?
So there would always be exceptions, even if there was a mandate for health reasons. So if you had an underlying condition that made it unwise to take the vaccine, absolutely, there would be an exception for that. And we will figure that out on a case-by-case basis.
Yeah, and I just wanted to add that, it's like the superintendent said before, this vaccine is not mandated yet because it's still under emergency use. But the flu vaccine, for example, where we work at VCU, the flu vaccine is mandated for healthcare workers. But there are exceptions, and there's individuals who cannot get them. And those we go through, through employee health, and you get the clearance. I say, no, you can't get it, and that's the end of that.
And the last thing, it kind of strays away from, I guess, the pandemic. When will this is my first time hearing about the June 1st deadline. So when will we get a little more broader information on the options to be able to, pick and choose whether we're going to be virtual or in person, or how would that work? I've heard it for the teacher standpoint, but as far as for the students, I really don't have a lot of details of the virtual Virginia. I went on the VDOE website, and it's not too much information about it, and also it doesn't have pretty good reviews. So is that something that is written in stone, or would something be reconsidered for middle school and high school students?
So in tonight's RPS Direct, I will have information going out to families about the options. And we have a nice one-pager which kind of lays out information about the virtual pathway to answer a lot of questions. It is not up for discussion to use virtual Virginia or not. That's something that the board has already approved, and we've begun the work to put that in place. My sense of virtual Virginia is that, as with every educational program, there are strengths and there are weaknesses. I do know that the VDOE is investing even more in the program, and we actually already use the program for some elective courses at the middle and high school where sometimes we don't have enough teacher capacity. So I do think it is a very good option. Of course, we would never put something in front of you that we couldn't stand behind. Is it the same as in person? No, but I don't really think anything is. But we will take a note, Dr. Harris and others, to make sure that we're getting even more information about virtual Virginia for families. And maybe we need to do some sessions just about what virtual Virginia is, how it works. I think that might be helpful for folks like Ms. Williams.
So would the schedule still look the same? Would they have like an even or odd or a 4 block or however that is? Would those schedules, like how they have now, be still similar to that? Not the online portion, but if they were in person, would that schedule still look similar to that on a virtual platform?
You're saying with virtual Virginia have the same 4x4 schedule?
Yeah, or like the even or odd, or I may be saying the same thing at once, but
yeah. So we're staying with the 4x4 schedule that we had this year, meaning there's no even odd days. The even odd proved to be challenging and not as academically helpful in years past. And so we're sticking with the 4x4 that we had this year. My understanding is virtual Virginia is also on a 4x4. So that's why if you did virtual Virginia and you wanted to come back, we are saying that you have to do that at the semester point after 4 of your classes have concluded.
Okay. Thank you.
Sure. Thank you.
Thank you so much, Dr. Harris. Were you going to make a comment before we move on to the next question?
Before we go to the next question, as we said, like, this is a conversation, and I just want to give a big shout out to Metropolitan African American Baptist Church. We have 39 families right now who are watching this town hall. Again, we had this virtual option. You could call in, you could Zoom in, or we had in-person sites in the region. We have an interfaith council that Superintendent Cameras and myself helped to lead with lots of our faith-based partners. And I just want to thank all of them for helping to get the word out. And that's just a strong example of what we can do when we partner together. So shout out to all those 39 families who are there watching. Thank you, thank you, thank you. So I'll turn it back over to you, Chastity.
Thank you so much, Dr. Harris. I want to echo that sentiment and also just give a big shout out to everybody on the Southside, our Southside liaisons and people that are out there supporting for today. But I'm going to go ahead and move over now to Ms. Patricia McGowan. I'm going to have you unmuted so that you can feel free to ask.
Good afternoon. This is Trish McGowan, proud retired educator of Richmond Public Schools and graduate of Hollins University. Proud of that as well. Ladies and gentlemen, what I would like to know is, will you have logistics floor plans available for people to see with regards to the classroom and the cafeteria? I'm very concerned, all right? I know I taught at Lucille Brown IB program, Henderson Middle School, Franklin Military Academy. I was teacher next door at George Witt, so I'm familiar with the buildings, okay? So I'm looking at how many students you can get in the classroom with 3 feet distance between each other, because I've looked at the CDC guidelines very carefully. And I'm trying to see exactly how we're going to do all of this rotation, how we're going to assure student behavior, just the logistics of it that no one's really discussed. Everyone's talking about mask wearing, beautiful. I mean, do we have the personnel to make sure the students accommodate the behavior that we want them to do, because they're going to be so excited to see each other, particularly high school where I taught middle and high. So the logistics of it all, will that be available to the public? And I don't mean the redacted version. I mean, seriously, will it be available per building? And also, now this may be difficult to do, and I'm sorry I'm throwing so much at you, but you would need to know what percentage of each individual building, what percentage you have vaccinated. You know, you can't mandate it, of course, right now at this moment, but you do need to know what percentage of my teacher population, what percentage of my student population and other personnel are vaccinated, so I know what is the risk for this particular building. Are you following me?
Thank you, Ms. McGowan. Yes. You know, the challenge with knowing the exact percentage per building is a data challenge. No one is obligated to share their personal medical information. And so the data that we have on staff is incomplete at best. And so we cannot guarantee that every staff member has been vaccinated or will be vaccinated. But again, are strongly encouraging all staff to do so, as we are families as well. And again, students down to 16 years old. If a family is not comfortable sending their students, if they cannot be sure that 100% of the staff are vaccinated, we understand. And that is why we are offering the virtual pathway. Again, I do think it's important, and a number of studies have come out talking about this. We have to weigh the risk of COVID transmission against the risk of not being in person in school. And obviously that is a question for every family to make. It's a personal one, and I respect all decisions on that. But what we have learned is that the risk of transmission, even this past year when there wasn't a vaccine, when all the mitigation strategies are in place, the risk of transmission in school was very, very low. With a vaccine, it is extremely low. On the other side of the ledger, we know that children have, in general, this is not true in all cases, but in general, have suffered more depression, anxiety, and other mental health and physical health issues. Obesity is up as well. And so my encouragement, and I would defer to Dr. Papa and Dr. Munoz to share more about this, is to not look at just the risk of transmission in a school, which again is going to be extremely low once the vaccine is widely available, which it is now, against the risk of continuing to be isolated from one's peers. So I'll throw it to Dr. Papa, Dr. Munoz, if you have anything else to add on that front.
Well, I just want to second what you just said. It's extremely important. We have seen it. The American Academy of Pediatrics has reported it. There has been a significant mental health impact on the children across the entire country. And a lot of that has been related to just the breakdown of the normal social and educational activities that they were. So I think everything has a risk, right? There's a risk for going to school. There's actually a risk for totally disrupting the life and the daily experience of our children. So I think as long as we do it safely and take all the precautions, I think it's the right way to go. I just wanted to make a quick comment that we didn't bring up before, and I'm sure you're all aware that probably sometime in the next 2 to 3 months, it maybe even be sooner, over the next 2 to 3 months, one of the vaccines is going to be approved down to the age of 12. So I think when that happens, I would again for that group encourage, because that would really impact a large population, especially like somebody said before, the unruly middle schoolers. Having had 2 of those myself, I think having that vaccine available for 12 to 15 will really, because that means that from 12 and up, they can be vaccinated. I think that's going to be another big step forward into getting back to normal.
Well, thank you so much, Dr. Munoz, for sharing that extra tidbit. I'm going to remind everybody that is watching that you can please utilize the raise hand function in order to be added to the queue to ask questions. And in the meantime, as you guys do that and gather questions, if you have any, I am going to hand it back over to Israel, who will take some more questions from the chat.
Thank you, Chastity. So we have quite a few more questions in here. So again, as I did before, I am going to choose them randomly. So let's see. So this one is from Mr. Jonathan McDearmon. Is it safe now? Why are we not having in-person the meetings? It's going to be less than the school hours. If the students are sick, not necessarily COVID, can the students take classes that day virtually? Are students keeping their computer next year at home?
So I'll take the computer question. I didn't hear the other ones well enough to fully understand. On the computers, we're going to be gathering up all the computers at the end of the school year to do repairs, refresh software, all kinds of things of that nature. Then when we open back up, the current thinking is that at the elementary level, students would have access to those computers at school, and likely at the middle and high school level, they would probably take them home with them, back and forth each evening. We're still working out the details on that, but at a minimum, we're going to be a school system that has a Chromebook for every child. So that is one silver lining coming out of COVID, and we will be using all of that technology next year. In fact, over this past year, we've been doing internet upgrades so that our schools can actually handle all those computers online at the same time. So that is one, again, silver lining of the pandemic that we will have for next year.
Thank you, Superintendent. There is another question from Cami Smith, and that is, What will happen to the facilitated learning centers when schools reopen? Will they offer before or after care?
My understanding is once schools reopen, the facilitated learning centers will close. Our schools will have before and after school programs just like they had in the past. So I would need to check with the partners that run those centers, but my understanding is they will not be operational next year, given that we will be back fully in person. You're on mute, Israel.
Sorry about that. Sometimes I get confused with the, sometimes I don't know if I unmuted or muted myself. Sorry about that. So yes, the next question is from Mr. Jonathan McDearmon. What safety measures will be taken with the students riding buses? Is there going to be social distancing on the bus, and how many students will be in one bus?
So we'll have a couple of things on the bus. First of all, the simplest thing we can do is, weather permitting, have the windows open, which we will do on all of our buses. We're also, though, placing filtration units in our buses when we can't have the windows open. We will have 2 students to a seat, but again, they'll be masked. We'll have the filtration, we'll have the windows open. And again, we know the risk of transmission is extremely low. Again, as Dr. Munoz noted, it's likely that by the summer, vaccine will be available down to 12-year-olds. So, roughly half of our student population could likely be vaccinated by the time we return as well. So that's an added safety measure.
And I also just want to say, you'll see the name Jonathan McDermott a lot, Israel. He is actually in the community. We're everywhere, you guys. He's in the community right now, live translating for some of our Spanish-speaking families. So you'll see comments from him in English. But we made sure we were everywhere tonight, getting live questions from families in the community and in certain centers around the community. So thank you, Jonathan. And if you see that name a lot, that's why. Thank you.
Thank you very much for that. We have another question from Robin Linders. The question is, have you considered building additional outdoor classroom space to alleviate potential capacity challenges?
We considered it. We ultimately decided not to go that route for a number of reasons. One, it's a huge expenditure that would really be a one-time expense for a very short time period. 2, it's something that takes quite a bit of time to set up. It's not just erecting the portable unit, but it's connecting electricity and plumbing and all the other ventilation things that you need to do. And then 3, again, we feel with the mitigation measures that we are going to have in place and with the vaccine, it's going to be, again, the risk of transmission is going to be extremely low. And as we know, even when there is transmission, of course, one transmission is one too many. The risk of serious illness for children is extremely low. So we're talking extremely low on top of extremely low. And again, I don't want to underestimate the concern that some families have for children with unique health conditions. Absolutely, totally understand that. But I also think we have to begin to make the mental shift to a place where we recognize the risk of transmission relative to all the other risks we face in life every day. Unfortunately and tragically, every day, many children are killed in car accidents every day. That's why we do mitigation things like put airbags in cars and wear seatbelts and drive appropriately and don't speed. But the risk isn't zero. And we get in our cars every day and we take our kids places and such. And so I think we have to begin to reframe our own thinking about this. And this goes for me as a father as well, about placing the risk of transmission in the context of all the other risks that we ourselves face and our kids face.
Thank you very much, Mr. Cambras. We have another question that was asked a while ago from Vet Greenberg Knox. She says, I am a parent of 2 RPS students. Will there be mask breaks for students and staff? What will recess and lunch look like? Have you considered a half day for the VPI and Head Start program? How long? That is a long day with rest included. Can you change from in-person to virtual?
A lot of questions in there. You know, on the masks, again, as I think was shared earlier, we certainly want to be flexible. If there's a student who needs a mask break, to have an opportunity to go outside, take the mask off, get some breaths of fresh air, of course. And I think this goes back to that first comment I made about grace and love and flexibility. You know, we are going to work as hard as we can to try to think about everything on the front end, which is why this session and the ones that will follow it are so important, because we're smarter when the whole village is thinking together on this. And so we're going to take all these questions, add them to our FAQ document, and get answers out to folks. But there are going to be things that none of us think about, and we're going to need to be flexible and treat each other, kids to kids, adults to adults, adults to kids, with grace and understanding, and be flexible as we work through this to figure out good solutions to all the questions that come up. But absolutely, if a child needs, or a staff member needs a mask break, we'll make sure to allow for that.
Thank you, Superintendent. There is one question from a Hispanic parent. In Spanish, the question says, I have heard that the kids who go to JL Francis are going to go to in-person classes, but that they will not be going to JL Francis, that they will be going to other schools. Is that true?
For next year, no, that is not true. Students who are supposed to go to JL Francis will go to JL Francis. If they decide to go virtual, they will be with students from all across the school division. But if they are in person, they will go to JL Francis.
Thank you, Superintendent. It looks like we have a raised hand. So Chastity, I don't know if you could go ahead and unmute that person.
Absolutely. Thank you so much, Israel. I want to thank all the participants so far for being here and all the wonderful, wonderful questions that you guys are asking. It looks like Miss Letitia Irby has a question again. So Miss Irby, I'm going to go ahead and select you so that.
Hi again. My question was about open enrollment in specialty schools. I apply for open enrollment for my student or my child, and if we choose to do virtual or in person, will they lose their spot if they choose to go virtual instead of going into the building?
Absolutely not.
Okay, thank you.
You're welcome.
Thank you, Miss Irby. And Superintendent Cameron, I do just want to kind of double back. My thoughts are that the question that family asked around the Francis may be if they are confusing or thinking about summer school information. So I did just want to name that just in case, if that was a Latin American family, they may be thinking about the summer school assignments.
Thank you, Chastity. Great point. For summer school, we are not using all of our buildings. We're using a handful of buildings, and children from various regions of the city will all go to those buildings. I don't have the list memorized, so it might be that students from the JL Francis zone would attend another school for summer school. So yes, that is the case for the summer, not for next year. Thank you, Chastity, for clarifying.
No problem, Superintendent Cameron. And I did just want to let every family know that is on here that is a resident of the Southside. The Southside team and liaisons will be out in the community over the next couple of weeks, and we will definitely have those flyers and printouts with that information where you'll be able to see exactly what the school assignments are for your students. If you do opt in to summer school, we will also be out to give out door hangers, which will have scan codes that you can scan with your smartphone and go directly to our website to get any other additional information you may need about that. So I did just want to, give everybody a piece of comfort in relation to that piece. The information will be available in the community along with all of our Southside members in the next coming weeks. I'm not sure. It's not looking like we have any other questions right now. It's like, oh, hand raises. We actually do. So I'm going to go ahead. There is a, actually someone's joined from a phone, so I'm not sure of the name. I'm going to go ahead and unmute you. Your number ends in 852.
Hello?
Yes, go ahead.
Hi, well, I'm glad you guys saw my little hand. I have a question. I did the survey regarding the SOL. My son goes to he's in 6th grade, he goes to River City. And when I went into the, to do the survey, I have a few questions in my head that I was, I was hoping to see if maybe I could find a number now through you guys that I can call. I speak Spanish, so even though I speak English, I still have questions, regarding this test. For example, one of my questions is, what about parents after they sign for the survey, they change their mind? So which number can they call if they all of a sudden, change their mind and they want to say, no, maybe I should have said no to that survey, Is there any number that we can call?
Yes, Chastity, you want to give the number out?
Yes, the family support line number.
Sure.
If you will all give me 1 second, I will pull that up for you. 1 second.
Okay, and regarding the test, I think so when I was doing the survey, it talks about it says parents that choose not to do the SOL will do the Virginia Remote Student Progress Tests. We want to know, like, what is this test? Can you let us know a little bit more of this test? Is this test as the same as the SOL? I would like to know more about the test, Every year my son has been taking the SOL, but I know that because of the pandemic, so it's first time. So I would like to know as a parent, what is this test,
Yeah, absolutely. Let's do this. Is the number that we see on the Zoom a good number for you?
Yes.
Okay. And if you don't mind telling us your name?
Vanessa Rojas, John.
Wonderful to meet you. We will have somebody call you at that number to talk about the SOLs. We want to make sure we have somebody from the testing team who can answer all of your questions. And I'm not sure we have all the right folks for that conversation tonight. So if you don't mind, can we give you a call at that number and we'll follow up tomorrow?
Yes, that'll be fine.
Okay.
Señora, también. Señora,
Hello?
yo quiero darle el número de la línea de apoyo para usted si tú tienes más preguntas.
Yes, so that will be to contact the family support line. Is that what you're saying? Okay, sure.
¿Está listo? Ya lo tengo ese número.
Okay, I'm ready.
Okay, es 804 780.
All right.
6195.
Okay. That has been really helpful now. Thank you.
De nada, pase buena noche.
So I wish we could continue on. I know there must be a lot of questions, but I am going to bring tonight's conversation to an end and then turn it over to Superintendent Cameras and any school board members if they wanted to say any closing remarks before Israel says the final last words. I want to just thank him for his time. We have moved per the community's feedback to making sure when students give their time that they're compensated for their time. And we have moved to doing that for all of our students who host events and things outside of the school hours. I think it shows how much we respect them and their voices. So we're happy to do that for Israel. But more importantly, we are just so thankful Israel for his talents and for lending us his time and skills in facilitating this conversation for us. The first one, we always have to work out some kinks and bumps. So I just thank you all for your grace, and just really want to thank the students who drove a lot of these questions and helped us kind of organize. They've gone through dress rehearsals, and we have more students who will be hosting other sessions, but I think it's so important to have their voice a part of the conversation. So Israel, on behalf of the community, we thank you, and we look forward to having your peers help us facilitate these conversations moving forward. So Superintendent Cameras, do you want to have any closing remarks? And then I'll just ask you to turn it back over to Israel.
I'll echo everything you said. Thank you so much, Israel. So appreciate your leadership and your voice and your questions. Thank you, Dr. Papa. Thank you, Dr. Munoz, for being here tonight. Thank you, the entire engagement team, for making this all possible, and Chastity for helping lead it. And I just want to throw it to our 3 Southside School Board members to see if they would like to say anything. I'll go in district order. So that means Mr. Young, District 4, any final words?
It is really make us very proud at Huguenot. Keep up the good work, sir.
That was short, but very sweet. Fantastic, Mr. Young. All right, next in the 8th district, Mrs. Page.
Hola. I just wanted to thank everyone for taking time out tonight to share in this community conversation. And as we can see, there are so many questions that we want to, get the answer to, because I think someone said that COVID is something that we had not anticipated, never imagined this would have happened. But anyway, I just want to say thank you, gracias, for taking time to participate in the community conversations. And also there are other regional conversations that if you didn't get a chance to get your question answered tonight, you can participate in other regional community conversations. And thank you, the team, Superintendent Cameras, thank you for putting this together. And Israel, thank you for a great job.
Thank you so much, Mrs. Page. And Ms. Jones from the 9th.
Oh my God, I always have problems unmuting. Good evening, and thank you everyone for being here. Big shout out to the Office of Community Engagement. This is how you do it. I love it. This is what community is about. It's about listening and then providing the space for folks to be able to share their concerns and hear from the community. I also wanted to acknowledge our other colleague who dropped off, Dr. Shonda Harris Muhammad. She represents the 6th district and has Hillside Court. So we wanted to give her a quick shout out. Thank you, Mr. Cameras. And we appreciate all of your feedback, all of your questions. Israel, great job. You are leading the charge, and this is what leadership is all about. And as we continue to set the stage for one of the most important conversations that RPS is ready to have, we just want you to know that we hear you, we're here for you, and everything that you propose, we're going to try to do our best to make sure that we are listening and learning and reopening with Love 2.0. So thank you, Southside in the house. Me and Ms. Page, we got to say that, but we look forward to continuing to engage you, and thank you all to the team. Chastity, amazing, doctors, everybody. This was great. Thank you.
Thank you so much, Ms. Jones. And I want to echo your words to Dr. Harris Muhammad, who had to step out a little bit early. The 6th district is also Southside. With that, I'll turn it back to Dr. Harris to close us out.
And I'm going to turn it over to Israel to close us out.
Thank you very much. Those were some really nice words. I really appreciate it. I want to thank all of the panelists again for being here. We really appreciate your time and the knowledge that you shared tonight. I also want to thank everyone who participated in the conversation. Thank you for joining us tonight. There are more opportunities to engage on reopening. The next regional meeting is the Northside Regional Meeting on Tuesday, May 4th. For more information on how to join and a complete schedule of the meetings, visit www.rbaschools.net/conversations. If someone would mind putting that in the chat, well, I'll do that in a second. So yeah, there you will also find the schedule for the community walks. Check it out, see when family liaisons will be in your neighborhoods, sharing information about reopening. If you have any follow-up questions, please send an email to outreach@rbaschools.net. And well, thank you very much, everybody, and have a wonderful evening.
Good night. Thank you.
Good night, everybody. Thank you.